to have my RA and Cavalier King Charles Spaniel friend, Kelly Conway, here today. Welcome.
A twofer, thank you.
Yeah, I know. I'm so glad I got to finally meet you in person at the rheumatology conference, and then now interact with you more deeply on the podcast. So thank you so much for being here.
Thank you for really happy to be here.
Yeah. And can you just to start off, give us a quick intro to you and where you live and what is your relationship to arthritis?
Okay. Well, I'm Kelly Conway. I am the co-founder of the International Foundation for Autoimmune and Autoinflammatory Arthritis. I'm also the author of the blog As My Joints Turn, my autoimmune soap opera. I am from Philadelphia. Professionally, I'm a speech-language pathologist, and my relationship with arthritis, I started having symptoms at 14, tons of tests, nothing came back at 19. They actually did surgery on my knee, found nothing, and were very confused by it. So I kind of grew up feeling like a hypochondriac. In my early 20s, had a big flare up, but again, nothing showed in my blood. And then in my early 30s, I think it was around 31, 32, I had about a year of every single joint in my body swollen, in pain, wearing braces, going from doctor to doctor, and finally got a diagnosis of Sjogren syndrome, which I really don't think I have. And so they started treating me. And so my diagnosis has gone from rheumatoid arthritis to Sjogren's to right now, I think they're saying it's ankylosing spondylitis or non-radiographic axial spondyloarthropathy.
Yeah.
So they've never been, I wouldn't say I'm a mystery patient. I think there's a lot of people like me, but at this point, I think they changed my diagnosis to sort of figure out a medication that will treat me. I also have a skin condition, so they tried psoriatic arthritis for a while, but nothing improved with that. So. And I apologize if I cough. I'm just getting over pneumonia and COVID. So
I mean,
it's up on me.
well, and it's funny. My first okay, I have like a million reactions, but one of my first reactions to you saying that is like, wow, like I am so in awe of how tough all of my like autoimmune warrior friends are, right? We'll be like, I don't want to cancel this podcast recording. So I'm going to push through this, and where I'm like, also part of me is like, man, like I sometimes I don't want to like reward people for like pushing. Do you know what I'm saying? Like
Yeah.
I'm just like reflecting out
Well,
loud, but, or I don't want people to think like that you have to be like inspirational all the time, or you know what I'm saying?
right. And honestly, I probably feel as inspirational as a rock. I'm
Oh,
I'm so I'm so tired all the time. But yeah, it's hard. But I think finding other people was the saving grace for me, because my dog thinks she's a cat. She's blurred out there, but
I know, she's so great.
cat. We have twin dogs.
Yeah,
You posted a picture the other day, and I was like, when did I take that picture of Finny? And I realized it was Teddy.
I know.
Um, yeah, I think finding people like me with
Yeah.
very, maybe not exactly the same stories, but similar stories. And
Mhm.
it was like this big aha moment. And that's when I got involved with Tiffany Westrich Robertson. And we started, first it was a movement, then a foundation. And just because connecting with people was so important. And Dr. Google is a scary place
Yeah.
to
Yeah.
visit. And so, yeah, we just sort of, would you please stop? Thank you. Um, she's obnoxious right now. Um,
Okay.
but I think finding people, and I get very inspired by so many people. Like I remember meeting you years ago in Boston,
Oh,
maybe.
that's right. Yep. In 2019.
Yeah, and when I found out you were an OT, I was so
Maybe
excited because as a
2018.
speech
Yeah.
therapist, oh my gosh, that's so awesome. And I got you involved with our World Autoimmune Arthritis Day because I knew
Yes.
what a lot of people don't understand is that when you are in like rehab medicine or OT, speech, PT, you don't think of things. I look at a situation and I'm like, okay, how can I make this problem better? where
Mhm.
most people don't think of that. So all the adaptive stuff that you do, it's stuff that I've done from working with OTs for so many years. Um,
Yeah.
so
Yeah.
that's why I was so excited to meet you, because I'm like, oh my gosh, this is something that we really need to have people think about, that there are ways to adapt and make life easier.
Yeah.
And, it's not always I can't, it's I can, but with some modifications. Um,
Yeah. Oh, that's
and then
beautiful.
I met you again at ACR in DC. And I remember I didn't realize it was you. And somebody said, did you meet Cheryl? She also has a Cavalier
Yeah.
too. And then I looked, I'm like, oh, I do know her. Wait a minute.
That's
So,
so funny.
so
I know. Well, and yeah, I first of all, Tiffany did come on the podcast, and I will link to her episode in the comments because yeah, both of you are using that word inspiration. You're both inspirations to me. What you've created with the IFAI arthritis is just, I mean,
yeah,
it's such
it's,
a
it's, she,
example.
she truly, her ideas have always been amazing. And we've, evolved into AI arthritis. And she had this dream and she had this vision. And I've always been more of the backseat person,
Hmm.
and supporting, and because I'm still working full time, but
Hmm.
her vision is incredible, what she's built, and I'm just proud to be a part of it. I
But
think
yeah.
yeah,
It
we're
does
really
take a team. That's what I'm working on recently is delegating more. And, you need to have a visionary, on the team, but you also need the people to execute and, tie up
right,
loose ends and also just have a different perspective. So
right.
I love your guys' team, teamwork approach. But yeah, I actually, sorry, because we have so many similarities working in rehab fields and having the same dog, for some reason, I thought you had definitive, for lack of a better word, rheumatoid arthritis, but nothing is so clear cut. The
Yeah,
typical is to be atypical when it comes to these diseases.
exactly. And a lot of times, because it's so confusing to so many people, a lot of times I just say I have RA to general
Hmm.
people.
Hmm.
Who's ever heard of non-radiographic axial
Feels, yeah.
spondylo- spondyloarthropathy? Nobody has heard of that. And a lot of times when my doctor and I talk, like I have the sausage fingers and I have like the lower back pain, but then I also have like, symmetrical joint pain.
Mm-hmm.
So she's like, you have so many characteristics of different things. So we've really focused a lot on the spondyloarthropathy
Hmm.
for the
Hmm.
past few years. And she often refers to it as autoimmune arthritis, which, AI arthritis, when we were IFAA, that we were like one of the first groups to really start using that term.
Hmm.
And it just makes sense. I definitely have autoimmune issues and it manifests in my arthritis. So, day by day, it's always an adventure.
Well, and I just love the name of your blog, As My Joints Turn, My Autoimmune Soap Opera, which is a play on As the World Turns,
It
a
is, well,
American soap opera.
you're probably a little too young to remember this, but Carol Burnett had a show and she
Oh.
used to have a skit on her show called As My Stomach Turns, which was a play on as the world turns. And
Oh,
it just so overly dramatic. And my mom used to use that as like a joke, like, oh, her life is a soap opera. I call it As My Stomach Turns. And it just always stuck in my head. So originally my blog was like, oh, my life with, arthritis. It was just something simple. And then one day I was like, As My Joints Turn. That's the name. So I
that's
do. I,
perfect.
I I love the name, and I keep the domain because I do. I haven't been writing as much. I've been focused on other writing lately, but I
Yeah.
try and bring some humor and some realism. I'm not one to give advice and research topics. I just basically blog about my life and what it's like living with the disease. Because sometimes I
Yeah.
think people just need to know they're not alone.
You know what? It's so I have come so full circle on that because I felt like initially, like sharing my story
Mhm.
wasn't enough, quote unquote. I was like, I want to share all my like OT tips and hacks, and people still really respond to those, right? Or like help people understand, like, let's say, for example, how fatigue works or what we know about how fatigue works in autoimmune disease and what we don't know, and all these deep topics. But so often, what people say that they respond to the most in something I've shared is like, let's say they're 23 years old, they just got diagnosed. So like, it's nice to see that you like have a job and have a kid and like, or have a dog, or like just doing the normal, like elevating the normal everyday living that and thriving you can do in your daily life, is something that's really valuable. And you, like you said earlier, knowing that you're not alone,
Right.
um, in the soap opera elements of it. And I think even just, we could spend the whole hour just talking about what it's like to not have that definitive diagnosis to ground you. Because for me, having it, I was in the mystery, quote unquote, accused of being a hypochondriac category until I wasn't. Like, it was only a couple years, and those were horrible years, but when I was feeling really sick and didn't know why and went to all these different doctors. But then when I got that definitive diagnosis of RA, it was like, this is a textbook case, home run case. Like, every single one of your numbers is like off the charts. You have the subjective signs, you have the objective
Right.
signs. You have a great aunt that has rheumatoid arthritis, like, so a tiny bit of a family history, like it would have been even more of a home run if it was like a full family history. But, so there was no doubt ever since I got my diagnosis. And I think I've taken that for granted. Like in your case, I think it's hard to, I'm just
Mhm.
imagining it's hard to have that ambiguity.
And nobody wants a diagnosis, although you want a diagnosis. You know what I mean?
Yes. It's
That's so confusing. And I've written about my diagnosis journey several times. Rick Phillips, who
okay.
does
Oh
RA
yeah.
diabetes, he always used to do an RA blog week, and he included me, even though I was always like, I don't know what I have anymore.
Yeah.
And I would write about diagnosis journey. And then I've recently moved into writing books. I'm a big romance novel fan, and I've been writing books. And I decided years ago, I read a story, and the author wrote about her mother-in-law passed away from rheumatoid arthritis lung disease. So
Yeah.
like the fibrosis with lung disease. And I was like, thank you. Because my friend just lost her mother to that. And I was like, I've never seen anybody mention, you know, and I was like, maybe people will read that and look it up and then learn something. So I just decided I wanted to write stories that showed people going through their journey of diagnosis. And the one book I just finished, it is my story of diagnosis. It's definitely not my life in the story, but that whole part. And I read it and I gave it to some friends, and I'm like, is it too confusing? They're like, well, it is kind of all over the place. And I'm like, but that's what it was. And I
Yeah.
really didn't want to change it, because it was going from doctor to doctor. It was, wanting a diagnosis, but not wanting a diagnosis. It was wanting answers, but hoping I could just change my diet and everything will be okay. And
Yeah.
so I kind of poured that in, and it was hard. And I had to sit back, and I haven't reread it in a while, but it was hard putting it down on paper and really, oh my gosh, she's resting her head on my shoulder.
Okay. That's
Um,
okay.
yeah, it was hard going back to it, because I'm like 20 years out already. And thinking
Wow.
about, how hard that was and how I was made to feel crazy.
Oh
And I
yeah.
was told, it took you so long to get sick. It took you so long to make yourself this sick. It's going to take you a long time to get better. And I remember sitting in my car
What?
when, oh yeah, sitting in my car when that was said to me. And I literally was like, wait, I did this to myself.
Yeah,
What?
that it
Yeah.
that's wrong. I mean, obviously, you don't need me to tell you that.
Remember at the end, she said, you need to get yourself some help. And I was like, oh, I'm going to get myself some help. And I'm going to get myself a doctor who can help me and not blame me.
Wow.
And I hung up the phone. I never went back to them again. But
Yeah.
it was just, I have some of those memories that just stick out in my mind. I could forget why I walk into a room, but I'll never forget so many pieces of those vignettes in my mind of trying to figure out what was wrong with me and how sad I was and how
Yeah.
bitter I was. All my friends were having kids and getting married, and I walked out of a supermarket because I couldn't lift my arm up to get a box of tampons off a shelf.
Mm.
And I was too embarrassed to ask for help. And then I would get a message from my friends like, hey, do you want to do this weekend? And I'm like, I can't. I can't, I
Wow.
can't. And so it was very painful. I
Yeah.
didn't write a lot about that, but just all of those things just stick in your mind. So when 20 years later, um, people will say, "Oh, I bet you wish you just didn't have this." And I'm like, "Of course I do, but I have to look at all the things it did bring into my life. It brought me some friends that are, very close friends. It got me opportunities to do things." And my mom will still say, "Don't post that on Facebook." And I'm like, "Mom, I
So
post
will mine.
I got I
That's so funny.
you got to remember I'm an advocate. Like, people expect me to post things. And I'm
Yeah.
not, and I know some people think I do it for attention, especially, family probably. They're like, "Why
Mhm.
is she posting that?" But, I do it because it connects with people. And I was so desperate in the early days to connect with somebody who understood.
It is really it I truly believe it's a trauma to be undiagnosed or to particularly to have to have doctors who don't believe you or who accuse you of faking it, because it's one thing, and I will replay this probably the rest of my life. What I wish the doctors had said to me, and again, this was only 2 years I went through this. I mean, you've gone through 2 decades, but not to play like suffering Olympics, but you know, I wish they had. It's okay to say a doctor to say to me, it would have been okay for them to say, "We don't know why you're feeling so sick. Like we understand that like a year ago you were the captain of the college soccer team, you were
Mhm.
eating healthy, you exercise every day, you're super muscular. Like I could literally run a mile in like 5.5 minutes. Like I was the picture of health. Nothing happened. I
Right.
just started wasting away and then had one joint that hurt and the rest of my body just felt really off, and until the morning I woke up and all my joints hurt. And then I got my diagnosis. But long story short, if they had just said, "We believe you," like there's no like they would be like, "There's no reason for this to happen, so you must be making it up." Whereas I'm like, "I have no reason to make it up." Like, so you can see me getting
Exactly.
riled up. Like, so if they just said, "We don't know why, but," and we honestly, like, "I've reached the end of what I can do to help you in this moment, but I believe you. And like, here's some resources, or come back if anything changes." And like, that would have been such a different conversation than this
Exactly.
kind of like, well, I can't figure it out, so you must be faking. Yeah. Anyway, so I'm just
It's
so sorry you've gone through that.
Well, and I had, when I finally did get a diagnosis, I went to this doctor. She was brilliant. She really helped me. I didn't feel great, but I was so much better than what I was. I was no longer wearing braces. I didn't limp. I did limp, but I didn't limp every day. I was doing a lot better. And she ended up changing jobs and she sold her practice. But she ended up selling it to somebody at a different hospital. And even though it wasn't that much further, I just didn't want to do that. So I found another rheumatologist in that hospital, and he literally looked at me, looked at my blood work, and said, "There's nothing wrong with you. I think you should come off all your medication."
Okay.
And I was like, What? He goes, "There's nothing wrong with you." I go, "Then why are all my joints swollen?" "I don't know. I, well, I'm
Wow.
pain." And he
Wow.
refused to redo my prescriptions, like the even the like Plaquenil. He refused. I didn't need it. So I finally went to the doctor that my doctor sold the practice to, and she sat with me for an hour and a half, and I told her what the other doctor said, and I was like, "Is this all in my head?" And she pulled out my file, which was thick, and she goes, "This is not all in your head."
Yeah.
She goes, "And the person I trust more than anything is the person who she got the practice from." She's like, "I mentored with her and I interned with her and she was my mentor." And she's like, "You're absolutely not." And she sat with me for an hour and a half, and I was like, "This is my doctor."
Yeah. I
Yeah.
mean, if you can get, and people who live in more like urban areas, like,
Mm.
have more options. In the
Right.
rural areas, you might not have access to second opinions, but I really do advocate, if possible, or if you don't feel satisfied, with the care you're getting, or you feel like the person, isn't listening, or you just have a complex case. Some people
Right.
have just complex cases. And that's actually why a lot of people, I actually ask rheumatologists all the time, like, "Why did you choose rheumatology?" I actually feel like it's the hardest medical specialty. Like,
Mhm.
people think like brain surgery is the hardest. Well, at least you can look at it. Like there's the brain. Like I'm doing surgery, like here's this vessel, it goes here. Like, whereas with rheumatology, it's like so ephemeral, right? Like there's these conditions and no one really understands exactly how pain works, and they fluctuate and they're dynamic. And sometimes like, why does Enbrel work for some people with RA and not others? And why do the JAK inhibitors work differently than so anyway, you have to have a high, I call it like an ambiguity tolerance, just like they call it with kids, we work on frustration tolerance. I think with autoimmune, we have to work on our ambiguity tolerance of like, I don't know, it could be this, it could be that.
Right. And my doctor has been really good, and we'll say, well, how can we make this better? And I said to her at one point, I was at a point in my life where I was like, I don't think it can get better. I don't believe, because it hasn't in so long. So it's a roller coaster. It's definitely a roller coaster. And right now I'm on medication that I feel fairly good. I've been failing on medication for almost 2 years, finding nothing that worked, and tons of steroids. And I've gained so much weight, and I feel horrible about myself. And I would try to walk, but when I would walk, I couldn't work because I was so much pain at work. So then everything kind of got thrown off. So now I'm on a medication where I'm doing infusions, which is a hassle to go and get it done, but I'm doing it, and my body feels so much better, but I'm constantly sick. And
Trade-offs.
it's the trade-off. And I'm not like just a sinus infection. I'm like, oh, pneumonia. Now I just got over a bout of COVID and then rebound COVID. And that's not from, obviously it's not from, I was exposed to that and that's how I got it. But I've just been so run down and so hard. Just every little day things. It's just even showering. Like, I'm like, I gotta go shower tonight. Okay. Like, it's just, it takes so much energy to do everything, and taking care of my, my elderly mom, just even doing her laundry for her. I'm exhausted. And then, God love her, she'll say, oh, can you go do this for me? And I want to get angry because I'm like, I really can't do it, but I can't say no to her. And then, I'm struggling this week, but it's a balance, and sometimes it's hard to find that balance.
Absolutely. Yeah. It sometimes you just only have so much energy, but and I think it is such a trade-off. Like, okay, I want my joints to feel better and I want to control the overall inflammation, but is it worth
Exactly.
the increased infection risk, especially when you work with kids? And so that brings me to my next topic. Because people do, especially the young people getting diagnosed with, autoimmune arthritis, often will be like, how did you choose to be an occupational therapist? Or, what are some career fields that are easier or harder to do? Did that factor into your decision, or did you always know you wanted to be an SL? Or tell us what you do. Sorry.
Okay,
They
well,
can't read my mind, people
I'm,
listening.
I'm a speech language pathologist.
Yes.
I fell into it. I never heard of it as a kid. I went to Catholic school, so we didn't really have
Okay.
therapies. I was in the School of Communications, and I was trying to apply into the School of Communications at my college, and they just didn't have any more room, and they stopped taking applications my sophomore year. So they said they were not taking any for another year, possibly two. And I was like, well, what do I do? So I was talking to a friend of mine, and she said, oh, well, I take communication disorders. So I was looking at her classes, and I'm like, that sounds interesting. And I wanted communications, this is communication disorders. And the funny thing is, I walked into my first classes, and there was my best friend from high school and her college roommate. So the three of us are still SLPs today.
Amazing.
Yeah, two of my closest friends are speech language pathologists. And what I say to, I'm always, most of the people I work with, they have no interest in taking students, but I always do take students, because I think being a speech therapist or an OT or PT, I think they're the greatest jobs ever, because you have so much flexibility. I could go virtual. I could work in a hospital. I can work in a school setting. I could do accent reduction. I can do all kinds of things Granted, you have to become highly qualified in these things and
Yeah.
know what you're doing. Do I know what I'm doing in accident reduction? No, which is why I don't do it. But I know
Right.
it's something that
But you
I want.
could.
Exactly. I could if I looked into it. You could do, feeding and swallowing therapy, which I do really enjoy. Um, and it was kind of interesting when my dad needed speech therapy for swallowing. It was funny that I was telling him stuff, and of course, oh, who are you, a doctor? And so
Right.
then speech therapist would work with him. I'm like, oh, that sounds so familiar. I wonder where I heard that from
Yeah.
before. So like those little things. But I always say I don't know any OT, PT, or speech therapist that don't like what they do. They don't like the paperwork. They don't like
Yeah.
dealing in insurance and all that stuff, but they all love what they do.
Right.
Um, so I think those three careers, I am just very passionate about trying to get kids to do them, to look into it. So I recommend a
Right.
lot of kids go in, and all the kids that want to be doctors, I'm like, become a rheumatologist. So
Yes. Yes.
with
Yes.
high kids, so it gets brought up a lot, and I'm like, you should go into rheumatology.
Yeah, I do the same. I try to encourage people too if I know that they're in med school. But yeah, can you just briefly tell the listeners, because I think a lot of people hear speech language pathology and there's this old idea from when I was young that speech therapy is just helping people articulate better,
Right.
which I did go to speech for articulation as a child because I was Shewo Quo
Yeah.
for a long time. I really struggled with R and L.
Well, R
Yeah.
is the reason I dye my hair because it stresses me out.
Yeah.
Um,
Oh,
yeah. So
that's happened with me.
I again, I didn't know about that. I didn't remember kids going. I know kids did go to speech therapy because I remember kids who said R's and L's incorrectly. That's one part of my job. I also work with kids who have expressive and receptive language disorders. So, how they are able to express themselves, how they're able to comprehend spoken language. Sometimes kids have disorders in terms of fluency or stuttering. There's voice issues. Not always my specialty with voice issues, but I have worked with people with voice issues with Parkinson's. Um, but my area of specialty, I've really focused the past, 32 years on autism and augmentative and alternative communication. So my area of specialty is really people who either need help augmenting their speech, or we need to give them an alternative means of communication, such as using a device that will speak for them. That's really my passion and what I specialize in. And I used to do more volunteering with like ALS patients and helping set them
Mhm.
up and troubleshoot when they couldn't get in touch with people. That's something I really enjoy. Uh, and I love when my kids will come in and they'll give me some new and exciting information on their device, and they're so
Yeah.
excited to tell me something. And their parents will say, oh, my daughter texted me the other day using her device. And I'm like, I still have kids that I taught how to text years ago who still text me like 50 times a day. And that's
Oh,
fine. Nobody's supposed to have
that's
my
so
phone,
sweet.
but you know what? It's in their program, and they have to text somebody. So they're going to text me. And,
That's
the one
so
remind
great.
me whenever the voice is on or Dancing with the Stars. And so
Yeah.
it's all about communication. So speech is, people often look at OT and PT and they're like, you can see a physical,
Mm-hmm.
you can't always see a speech issue.
Right.
So about learning how to become a better communicator. And probably the most work I do is in pragmatic language and social skills, and I work with secondary students, so middle and high school.
Oh, that's so
And
great.
it's just really fun, like helping them prep for job interviews, and how to engage with peers. I've even, how are you going to ask somebody out on a date? What are you going to do if you really want
Yeah.
to? Going to ask them. And it's those little things. If you go to a dance, how do you make small talk? So I have a lot of fun with my job. I think that's why I'm
I
still
love
doing
it.
it. I love the people I work with, and I love the kids I work with.
And I think, yeah, I worked in both a elementary and a high school. And yeah, a lot of times people who go into pediatrics, they really want to work with the little kids. But, middle school and high school are such fascinating times, to be there for a child and helping with those life skills. Like we had a program through the district I worked for that also had like, it was called like life skills, and they would do 18 to 21-year-olds with disabilities would still qualify, for services through the school. And it's just really, yeah, helping people get a job at, Starbucks, or get, job experience. It's really, yeah, it's a great area if you want to really be able to help someone else improve their quality of life. But it can be hard when your own quality of life has been negatively affected by your own chronic illness, right?
Right.
So, can you share a little bit how you've coped on the job with, or I'm sure it's like ups and downs, but
Well, they like the invisible illness. When I first got sick, I was in grad school. So I was originally a special education teacher and I went back to school. Um, so when I was in grad school, that's when I got really sick. And so I think that going to school and becoming a speech therapist kept me sane. And I remember my one professor said, well, it's interesting, you don't have to walk well to be able to be a speech therapist. And I'm like, you don't, but when you work in a school and you have to go get the kids,
you were
you
doing
do.
a lot of walking in a school. Yeah.
Yeah. Oh, my high school is ginormous.
Yeah.
So I eventually, my original start of my career was early intervention. I did 3 to 5, and then I did
Mm.
0 to 3, which was a really interesting
Mm-hmm.
year, doing feeding and working with little kids and their families. And then 10 years ago, for my health, I was like, I can't keep working with kindergartners. I just can't. They use me as a tissue, and
Yeah.
that's who they are. But I get too sick. So I ended up switching to secondary. And I would say my first 2 or 3 years, my immune system was a little bit better, and slowly that's still deteriorated. So getting sick is my biggest issue with
Yeah.
everything, because when I'm sick, everything just gets thrown off. So
Right, right. And it's interesting. I remember asking my rheumatologist years ago when I first became an OT and I was looking into different settings. I always thought I would want pediatrics and, school-based or outpatient, but I also was open to other settings. I actually really liked my skilled nursing internship. But it was a pretty swanky skilled nursing placement. They told me, they're like, don't think that everywhere is like this. It was really nice. But anyway, and my doctor said, you would think that everyone who's on biologics, which are a kind of medicine for rheumatoid arthritis, you'd think that they would all be getting really sick all the time. She's like, but I have people who are flight attendants and kindergarten teachers and stuff who don't get sick all the time. So it's still, again, that ambiguity of like, some people are getting sick all the time, some aren't. Why is that?
but see, I was the kid growing up who always got sick.
Yeah,
I was the kid
yeah.
growing up that every year ended up in the hospital, I think, until I was like 9 or 10.
Oh my
Like,
gosh.
dehydrated, I would get really sick, I'd get
Mm.
horrible like infections, like sinus infections and bronchitis. And so I've just always been like this. And the older I get, the more I feel it wearing me down. Like this, in September, I had pneumonia, and which is
Oh,
interesting. It's the second time I've had pneumonia. Both times I thought I was having an RA flare. I
oh, okay.
attributed all the joint pain, the feeling lousy. I
Huh.
twice I've done this. It wasn't until I came home and I had 104 fever. I came home, I laid down, I woke up, I'm like, oh wait, no, something's really wrong. Um, but yeah, that's how lousy I had become used to
Mm.
feeling. So
Jeez.
then I got over that, and then I got hit with COVID, and then rebound COVID. COVID was a big topic for me. I don't know if I lost my father to
Yes,
COVID.
I'm so sorry.
He had
Yeah.
fallen prior to vaccines in 2020. He had fallen, broke a hip. We found out there was COVID in his nursing home, where it wasn't it was a rehab hospital, but it's set up like a nursing home. And we found out there was COVID in the building, and we tried to get him out, but we weren't able to. Nobody
Mm.
would take him. um
So
we were
hard.
talking about bringing him home, and I got the phone call that he ended up rushed to the hospital. And it was, he ended up with sepsis and the COVID pneumonia and everything. And people still will say, oh well, did he have pre-existing conditions? Yeah, but he didn't have COVID when he went to the hospital, and that is what
Mm.
caused everything to spiral down. And 3 weeks after he died, my uncle, same thing, fell in a nursing home doing rehab because we couldn't get him into a rehab hospital. And he
Oh
contracted COVID.
no. I'm so
So
sorry.
it was just extremely difficult. And again, being immunocompromised, very difficult. My mother was COPD. I made the cover of the newspaper because I drove like, I forget, like 300 miles round trip just to get her the COVID vaccine.
Oh my
Um,
gosh.
because I was adamant. And my mother did. She fell this past summer and she was in a rehab, and then she had to go into a temporary nursing home, and she did get COVID and she did get pneumonia. And guess what? She's fine. And if you would have asked me that back then, I would have thought my father would have survived COVID easier than my mom because of her breathing. So
Hmm.
yeah, I stressed that the vaccines worked for my family. And even though I ended up getting COVID 2 years and 9 months into the pandemic. I It was annoying because I don't get colds. I get sick. I get an infection.
Right, right,
Like
right.
I don't get a cold. And I felt like I had a cold. And I'm like, this is what I've been saying to doctors for years. I don't get colds. And I was literally sitting there and I'm like, this is not something I'm used to feeling. So it was a rotten cold, but it was
Interesting.
definitely a learning experience. And I didn't get as sick, but the fatigue is what's killing me. But COVID was something I wrote a lot about in terms
Yeah.
of how it impacted my life, why I was making the choices I needed to make, why I was being super cautious. Um,
Yeah.
and I think people did connect with it. People disagreed with me, and they're right. I'm not telling you how to live your life. I'm just saying how I'm living mine. Um,
Yeah,
but
it's
it's hard.
been yeah, and I think I it's funny because this hasn't come up too much on the podcast so far. But yeah, I'm curious because it obviously seems like you were very a really strong advocate for,
Mhm.
your mom getting the best care possible and masking, I'm assuming, and getting the vaccines. And how has it been like you do seem to be somebody who has good maybe like boundaries. Like I'm like a people pleaser, so I still struggle sometimes with being like um what are they going to think about me, like worrying what others think about.
Still get that. And through I had depression prior
Mm,
to all of this. So in 2020, I lost my dog, Georgia Grace, who again was the
yes.
ultimate Spoonie dog.
Mm,
I lost her the very 2 weeks into the pandemic, and my life kind of was crushed. Um, but somebody who bought the book that I wrote about Georgia got me my puppy, my Finny. So she brought me joy, and I think it was meant to be because I don't think I could have handled George's care, which was 17 pills a day and 2 shots of insulin, and
wow.
working 5 jobs. I don't think I could have maintained that with also taking care of my mom, losing my dad, losing my uncle. And then I lost a cousin Christmas Eve as well. So it was like kind of like a huge,
Yeah.
huge thing. So I think the puppy came into my life at the right time, but I don't think I was very good at communicating the level of depression I was going through.
Mm,
And I
mhm.
really did cut people off. And I've said to some people, I'm really sorry. Some people were like, we get it, it's okay. And other people have pushed me away. And there's still some people that I'm like, I need to repair those bridges,
Mm,
but I have no energy to do it. Um, but I sort of, my closest friends really did get it. Other people kind of just let me go. And that's fine. I was being a crappy friend. Um, at work, I really held my boundaries.
yeah.
Um,
Oh, have you I'm sorry, I meant to ask this earlier because people ask me all the time, should I disclose? And of course, I can't tell you whether you should or shouldn't disclose your disability in the workplace, but do they
I
know?
I don't have anything official with
Okay.
like accommodations.
Okay.
My coworkers know because
Okay.
I couldn't hide the limping. I couldn't hide that, I can't type anymore today. Or if
Yeah. Yeah.
there were days I couldn't get shoes on, so I'd come in with bedroom slippers. Um, I'm very open about that, and most of them are friends with me on Facebook, so they've seen my blog.
Yeah.
Um, I haven't needed accommodations other than handicap parking, and I
Right.
will. My dog is snoring. I apologize. can
Oh,
hear
I
that.
can't even hear it. No.
I dog, she's not as loud as my previous dog, but she's pretty loud. Um, but yeah, I handicap parking is something, and there's been issues recently in one of the buildings, and I just basically I went pretty hard and said, this is an ADA violation, and
Yeah.
I really, if you can't expect us to show up early before you block off a lane, if every able-bodied person doesn't have to experience the same thing.
Yep.
I think it makes me a little bit more compassionate towards my kids when they're really going through something hard. But I've often said to them, you're at a moment where do you give up trying to make this
Right.
better? Or do you figure out how to manage it better? Or do you try and fix it?
Right.
So I think I do have with some of my kids, I'm able to say, listen, I get how hard this is. I get how exhausting it is, especially my kids who have cerebral palsy or
Yeah.
um, sort of physical issues where it's hard, but you have to keep moving. So
Right.
how are you going to be the best you can be? And like I've said, any sort of diagnosis you get, whether it's you can't say your R's, or you get diagnosed with an incurable disease. When it happens to you, it's a big deal.
Yeah.
You look at the scheme of things and be like, oh, well, one is not as serious as the other. But when it happens to you, and I don't know if anybody's ever said this to you, when I was diagnosed with Graves' disease, I remember a very dear friend of mine said to me, oh, well, thyroid, that's not a big deal. And at the time, like my body was so out of control with my hormones. I was
Yeah.
so skinny. I was a size 2, and those clothes were big on me. Um,
Wow.
my body was like a rubber band, and I would get angry, and just everything was going on, and I did not feel like myself. And when that person said that to me, I was like, how dare you? But I didn't say anything because again, I'm a people pleaser. And then I
Right.
felt guilty. I'm like, well, she's right, I don't have cancer. And then I really, no, when it happens to you, it's a big deal, and nobody should minimize something you're going through.
Mm.
It's just and
Well, yeah.
it's not the end of the world. It's a different way of living in the world.
Yeah.
And it's hard to find that balance. And that's a balance that changes as you get older. Like you went from being somebody living with RA to being a mom with
Right.
RA. I haven't had that experience, but now I'm looking at how am I going to be a retired person with RA and afford my medications
Oh
and my
dear.
and do I want to live in a northern state because I live in Philadelphia? Do I want to
Mm.
stay here where there's snow? No, I want to move somewhere warmer because cold is painful.
Yeah.
Um,
You should go
so
move to Arizona with Wendy Hawk. Do you know Wendy Hawkins?
no, I
Oh,
don't. But
she runs a group, a
Arizona has
Facebook
been
group.
on my list because
Yeah.
my hair looks fabulous in Arizona.
Yeah.
The humidity is good, but I'm sort of at a transition place right now where I'm trying to plan for the transition. I just don't know what the right thing to do is. So I'm trying different things, and hopefully I will, my ultimate life, I would live on a big ranch with lots of rescue animals
Yeah.
and $1 million where you don't have to worry about bills
Oh yeah.
and you know,
Personal chef. Yeah.
yeah.
I
Like,
actually in our room to thrive group, there's this recurring theme of we call it like room island, like rheumatoid island, where like we invite people, we'll say, okay, this doctor's invited to the island or they're not invited. And it's like this island where everything that we want and need is there, right? Like
yeah,
all the people understand you and give you benefit of the doubt. The doctors listen. You have every chair is comfortable and you have heating pads and cooling pads, at the snap of a finger. And yeah, but sorry, I didn't mean I just went on a tangent from that, but
no,
about
those
retirement.
are so important. And like my car was just demolished in front of my
Oh
home, and
my
so
gosh.
I had to get a rental, and the only rental I could get on a holiday weekend was a Jeep Wrangler, which is an awesome car. They're awesome. They're very cool. I'm
Interesting.
not an off-roader, so I wasn't going to take the doors off, and it's freezing. But climbing in and out of it, my hip is killing me.
Oh
And
yeah.
the seats, it's a great car. It is a fantastic car. But I was like, you know what? I don't want to keep climbing in and out of this. It's too hard for me. So I switched it out and I got a Chevy. I think it's an Equinox right now. And I sat in it and I'm like, oh my gosh, this is so much more comfortable. Like I'm not in pain when I get in this. And sometimes I did, why am I'm having a brain fog since COVID so badly.
Me too.
A meditation, meaningful meditation, mindfulness
Oh, yes.
meditation. And I took a very amazing course through the University of Thomas Jefferson University Hospital has a program. And I've learned to kind of live with pain where I know I have it, but I can focus enough that I kind of keep it at my fingertips.
Yeah. Yeah.
Move a certain way, obviously it comes rushing back. But I think that's how I get through most of I keep everything here.
Right.
I acknowledge that it's there, but I focus on what I need to do as much as I can. And it works
Hmm.
for the most part. It's not a cure, but it definitely is a good, strong tool in my toolbox. But I think I'm so used to being in pain that when anything else gets added into it, like I broke my foot or,
Mm.
uh, I cut something, I can't deal with that extra pain. It's
Mm.
like
Yeah.
a sensory overload for me because my body is not used to that level of pain on top of the pain that I'm used to. So somebody said, one of the doctors was like, you must have a low level of pain threshold. I'm like, yeah, no, no, I don't.
Yeah.
But yeah, it's like all those little things. And like I said, from the beginning, having somebody who gets it and understands, you know,
Yes.
why would you switch out that car? Because my hip was killing me. Like I'm not an old
Mm.
woman, but oh my gosh, that hip is killing me from just pulling myself into it.
Oh, yeah. All of the little activities of daily living, like getting in and out of the car, brushing your hair, so many things can
That's why
become,
I'm in a ponytail because
yeah.
today there was just no way I could do my hair.
For years, I never blew my hair dry because it was just too much. I mean, also I just
Yeah,
was not interested in it as well. But yeah, once I mean it's work. It's work for your hands. It's energetic,
yeah,
expenditure.
rarely ever blow my hair dry. And so I always get ready at night. I
Oh,
shower at
that's a
night
good okay. That's a good life tip.
because I start work at 7:20 some days.
Mm,
I cannot, and it takes me a long time to fall asleep at night. I can't get up at 4:30, 5 o'clock in the morning to shower and get ready and I can't do that. So I
right.
shower the night before, I let my hair air dry, I braid it, and then I get up
Nice.
in the morning. And if it's a good morning, I curl it. And if
Okay.
it's not a good morning, that's why my hair is long now. So I can just put it up and
Hmm.
it is what it is.
Yeah.
I wear a lot of zippers. I don't wear a
Hmm.
lot of buttons. Um, I just can't.
Right.
Shoes are primarily mules because I
Hmm.
always tie shoes or handle the swelling that my feet go through during the day. So I have to be able to take them on and off.
Hmm.
Um, yeah, so it really does like it impacts so much of my day, but now it's just habit.
Yeah. Yeah, I mean, you kind of, one thing I recommend for people is like kind of become a detective in your own life. Like, what are all the little small areas where you could swap something easier, like slip on shoes versus shoes that you tie, a different kind of a wide grip for a pencil or a different way of holding the pencil, little things like that. Yeah, they could definitely give you some helpful life hacks. But I want to make sure that I give some time to talking about pets and the role, because you mentioned mindfulness,
Mhm.
tools um and then kind of a refocusing strategy where if you're in pain, kind of
Mhm.
refocusing on what's, your life. But what has been the role of your animals in your life and coping and the joy they bring, just whatever you want to say.
Well, originally, always had dogs growing up. And once I bought my house, I, I used to, the Jersey Shore, which is a very popular TV show. If you live in Philadelphia, the weekends are spent down the shore. We don't say at the beach. We don't say go,
Okay.
go down the shore.
Okay.
And that was my lifestyle. So every weekend I was down the shore in the summer. I traveled a lot. I didn't really have a lifestyle that I thought I could have a dog. Once I bought my house, I was around 31, 32. Again, I was still traveling a lot. And I had a dog that lived with my parents. And I didn't feel right getting a dog while she was still alive because she was mine. And I
Right.
gave my mom and dad because I couldn't have her with me. So I had cats that I adored. I never had cats. My mom never liked cats. She now loves cats. But I had cats and I loved them. And then for my 40th birthday, I was like, I want my dream dog. And I made a mistake because I didn't research the health. I read it, but I mean, I had a dog. She was epileptic, diabetic. You know, I thought I knew what we were doing. I was going to do. It was fine. And then I got Georgia Grace, who's a Cavalier King Charles Spaniel, like your Teddy, and my Finny Row. And Georgia was bred by a backyard breeder who loved dogs, but again, didn't do the heart testing, didn't do the neurological testing. And Georgia was a lemon, which is why I wrote the book Making Lemonade with Georgia Grace.
Yeah.
So at age 2, the dog that I got to get me, I researched like a dog that didn't need a lot of grooming. I could handle the brushing.
Right.
Excuse me. Didn't need a ton of exercise. Could handle the fact that I had a small yard.
Mm-hmm.
So I got a breed that I felt would fit my lifestyle. Plus, I was a big fan of Sex in the City, and Elizabeth Taylor was the dog on there.
Yep.
I had a coworker who had 2, so that was the breed that I wanted, and she was the best thing that ever happened to me. But at age 2, she was diagnosed with syringomyelia, which is a very painful disorder, and living in pain, I went into panic mode. I can't let my dog suffer. I can't let my dog. So I pursued avenues that like most people wouldn't. She was the first dog in the state of Pennsylvania taking cannabis. My
Wow.
dog had acupuncture. And every year she kept getting more and more. So, she had syringomyelia, which is and Chiari malformation. So part of her skull was pressing on her brain and she was leaking spinal cord fluid. So we did the acupuncture and I was told she wouldn't live past 3 by multiple
Oh.
because I wouldn't be able to control her level of pain.
Mm-hmm.
So she was on, by the time she died, she lived till she died right before her 11th birthday.
Mm.
She was on 17 pills a day,
Wow.
2 shots of insulin. Her medical care each month was more than my mortgage. And I worked 5 jobs just
Wow.
to give her quality of life. I went overboard, but I think everything I did, I was able to manage her pain. And I think it got to the point where I could just look at her and be like, okay, there's something not right. But I
Mm-hmm.
think she was my partner in sort of the whole journey.
Yeah.
If I hurt, she laid with me. If I felt good, she would go with me. And she was like my sounding board of, okay, I might need to take it easy today. Like she can't do
Yeah.
this. So let's have it be an easy day. And I think it was my neurotic desire to make sure her life was as pain free as possible. And also my knowledge of how to manage chronic illness kept her
Yeah.
going. And it's funny because again, Finny Roo was gifted to me and she's a blessing. And having a healthy dog is so different. And I knew I couldn't meet her needs. So she goes to doggy daycare and
Oh, yeah.
she gets a lot more, she's much more active. And I really try and make sure she's a pandemic puppy. So I'm really trying to like catch her up on all the socializing and
Right.
getting out and doing stuff. I think at some point she's going to make a good therapy dog. Georgia was a fantastic therapy dog.
Mm-hmm.
Um, I have to get this one to this point because again, she was pretty much with me only.
Right. Right.
So, but I think having a pet that you can manage, I love gray nose or blue nose pit bulls. I think they're the most beautiful dogs. Could I manage a pit bull? No, I can't.
Mm-hmm.
I couldn't give them. Do I love huskies? Absolutely. I love them all, but I can't physically take care of them.
Right.
Um, sorry, my phone was going off here.
Okay. That's okay.
Uh, sorry about that. Um, so again, I got pets that I can manage. I got
Yeah.
pets that I knew the size wise, I could pick her up. You
Well,
know,
that's
and
huge. I
it,
did it. I obsessively, researched before getting Teddy, and that was the thing that came up over and over again. Like the number one mistake new pet owners make is choosing a dog based on how cute it is and not based on how it fits your lifestyle and your abilities. Like I actually wanted to do a rescue, but I just, as a first time dog parent, never had a dog before, had a 4-year-old at the time and 2 cats. I'm like, I don't know if I have the ability to train, a rescue dog with a past that's unknown in a way that is safe, for my family. Even if it is one of these easy temperament dogs like a Cavalier, any dog has the ability to,
and
you know,
yeah, I do a lot with Cavalier Rescue in terms of donations, and we raise money for various organizations that really rehabilitate and rescue
yeah.
mill and mill daddies. And I never had a purebred. I rescued, we had mutts. Now they're called designer dogs, but I never had a purebred dog. Every dog came from the pound. Every dog was a
Yeah.
rescue. And now when I know, I work full time. I am not home during the day. I
Mhm.
am not rescuing a dog that I can't dedicate what they
Right.
need.
Right.
Getting a
Right.
puppy, she adapted to my schedule.
Right.
So she's able to be left home when I work. She's not alone. She has 2 cats.
Right.
Um, she loves it. I have neighbors that can get to her if I need, you know.
Mhm.
But yeah, it was rescue is a big passion of mine, but I know my lifestyle doesn't lend to it. And I know a lot of people have made the mistake with the best intentions to rescue a dog, and the dog just did not fit their lifestyle, or the dog
Right.
couldn't handle being left alone. The dog couldn't
Mm,
handle getting in the car to go to grandma's house. Like those
right.
little things. Right now, my dog is snoring so loud on my back, but she's a
Yeah.
cutie.
Yeah.
Yeah.
No, and I think I think you pointed out something I think is super important for people who do want to support,
Mhm.
animal rescues. Like we make a donation to the Humane Society, in honor of all the work that they're doing. And there's other, a lot of times nonprofits, they need
Right.
donations, so you can do it, you can help in other ways,
Exactly.
and
Now,
so.
not a rescue, but she was often featured on rescue websites. And she was,
Oh, nice.
when she died, I heard from 26 countries because, again, I wrote a book about her. So
Yes.
people all around the world knew about Georgia Grace. And I didn't
Wow.
realize that. Like, I used to joke, I'm like, yeah, I'm her momager. And then when she died, like, I got cards from around the world. I still get messages about her.
Sweet.
But we raised money, and it was an Arizona rescue. We were able to
Oh,
buy
okay.
off their Amazon wish list.
Oh,
And
that's amazing.
so much to me, because people really, towards the end, twice I had to have people help me because I
Yeah.
couldn't. Her hospital bills were outrageous, and she wasn't ready to leave me. Was
Yeah.
not ready.
Yeah.
And
Oh,
people helped me, so I felt so good that we were able to help dogs that really needed it, because again, Georgia was not a rescue, but I feel like in a way not many people would have kept her. Um,
no.
and there's one other person who had a dog with similar issues, and she's actually from Washington. His name was Stewie, and
Oh,
Stewie the Cavalier, and
okay.
Stu, and he had a lot of stuff too. Wasn't supposed to live, and his mom and I talked, and we're like, it was so hard, and she had medical issues, so you would think it would be so much harder. I'm sorry,
Oh, no. Yeah. No worries.
but yeah. So, you would think having a dog with special needs would be so much more taxing. And I do think it was, but
Mhm.
also it kept me focused. And I think I was the right parent for the right dog.
Yeah. Yeah. Well, I mean, I hope everyone checks out, your blog and also your books because they're wonderful. And I know that you haven't been feeling well recently. And so I appreciate you taking an hour to
Oh.
chat. But is there anything else you wanted to say before we wrap up?
Um, no, not really. I did, if they check out my blog, they'll see I did start, excuse me, again, I'm like,
It's okay.
I did start writing romance novels, which is not for everybody's cup of tea, but I wanted to focus on, they're called chronic romance, and it's about
I
people
love it.
diagnoses. So one is about someone with thyroid cancer.
Mhm.
I didn't have thyroid cancer, but I did have Graves' disease, and so I kind of went through the experience. And there's drama and there's romance and whatever, but and then the second one is called Dragonfly, and that's really about a person going through a diagnosis of rheumatoid arthritis and sort of what that was like,
Mm.
and just showing that you can have a career and you can have a family and you can have a life. And
Yeah.
again, it's not the end of the world. It's a different way of living in the world. And it's finding that balance is really key. So if I can
Yeah.
help somebody along the way find that balance, or just let them know that they're not the only person out there looking for that balance, then, the limp that I do is worth it.
Yeah.
So that's all. But I think we have an amazing network of people that we both know, that
Yeah.
I learned so much from everybody. I learned from you. I learned from Tiffany, from Chronic Eileen, from
Yeah.
Carice Hill, and
Yeah.
all these people that are just Deb Constein, like all these people who are
Oh,
just amazing, and,
yeah.
and just brilliant in how they can, I'll say, hey, my doctor said this and I'm just not sure. And within 5 seconds I have support.
Yeah. And it
And
truly, yeah, you really are not alone. And that's, I think, whenever, I go on this soapbox all the time about, the power of social media for a chronic illness community. And that, I know that there's downsides of social media, but having access, to people, I didn't know a single person my age who
right,
had even a similar condition. When I was diagnosed at age 21, we figured out. I kept saying
right,
20 because it was like the month. Yeah, anyway, it's a month before my birthday. But so, the fact that now people can get diagnosed and, in the wait, on in the waiting room after their appointment, they could just go, not Google, but like go on Instagram and like find people and just see what life could look like
right.
is really reassuring, I think, to people.
And social media can be a terrible place. And I think we were talking earlier about Effie
Oh
Kolipoulis's
yeah.
yeah. And I did write, and I forgot what I wrote, but I did have the title, and it was called A Stranger Thing, because
Ah,
people who knew me didn't know how to help me. It was
yeah.
strangers on the internet that I connected with that really did help me. And there are pitfalls, but you can get invited to a lot of arguments, but you don't have to accept that invitation. So there are people on social
Ah,
media, I don't have to engage with them if I don't want to. And it's not being elitist or me not valuing who they are. It's just I don't have to, engage with them. And I've really set very strong boundaries. Because I
yeah.
get people who love Cavaliers who try and friend me, and people who, have arthritis that try and friend me. And I'm like, if I don't really know you, I don't
Yeah.
we don't need to be friends. We can follow a social media page and just be just be friends that way. So I
Yeah.
think
Yeah.
it's definitely, connection is important.
Yeah, yeah, and I think I boundaries is something that I'm definitely still working on. So I appreciate anyone modeling healthy boundaries because I would just say I'm very inconsistent. Sometimes I'm in an optimistic mood and I'm like, sure, I'm gonna invite everyone into my life, and then I'll have to realize, no, like there are, you know, there are some things that are meant to be,
Yeah,
just
you get, and trust me, menopause gives you more bravery than you ever expected to
you know,
have.
I
Now
think
I
just getting older has, yeah,
yeah, I just don't care. And not that I don't it's not that I don't care with a lack of respect. It's
right.
that, you can have all kinds of opinions, and that is fine. But I found through my blog, I have a core group of people who followed me for years. I don't know why they still stick with me, but they do. Finny Rue would like
Yeah.
to say hello.
Hi.
Say hi. Oh, she's
Oh.
she's exhausted from sleeping all day.
Oh, yeah, that's how
Oh,
mine is. Yeah.
it's exhausting, my poor baby. Um,
Oh.
but yeah, and what's really funny? The funniest part of the whole thing, I'm in a group uh that does a lot with Cavalier Rescue, and there
Okay.
was a woman who followed my blog. I didn't realize she didn't know I was As My Joints Turn.
Oh my gosh. That is so, yeah, when people put the dots together, like, "You're that person?" Yeah.
So I posted a picture of myself in Georgia, and I get this message. She goes, "Oh my, how did I not know you were her? I
I
had
know.
no idea."
It just
Or
happens sometimes,
yeah,
yeah.
it was a big part of my blog back in the day because a lot of stuff that we did was very similar, and she was just so cute. Um, but yeah, people didn't know. So I probably have about 2 dozen people who followed me originally for my blog, but also had Cavaliers.
Yeah, yeah, yeah.
And
That's amazing.
yeah, it's so funny because I was like, oh, I thought you knew that's who I was.
It's such a small world. It
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 is.
truly it truly, truly is, and I think chronic illness is one of the things that it does transcend all, it transcends, it can happen to anyone regardless of age, religion, favorite dog breed.
Mhm.
Can happen to anyone. So, yeah, it's making those connections online has been just, yeah, for me being an extrovert, it's been a lifeline, especially during the pandemic when we were like physically isolated.
Yeah.
Yeah.
Thank Zoom, I got sick of it because it was really my entire life. It was work all day
Yeah,
long.
yeah, yeah, that's true.
And
Yeah.
was, doing podcasts and, I mean, I think all of us were in a panic in that beginning. I mean, we didn't think we would survive.
Yeah,
And
yeah, yeah,
I originally didn't want to take the vaccine. I'm like, no way am I taking a rush vaccine. And then it was actually talking to rheumatologists from all over the
yeah,
world. Oh, yeah, I'm going to take the vaccine. I
yeah,
get it.
yeah.
Um, and again, it's a personal choice. And, I have very strong feelings about everything that happened because I had such traumatic loss.
Yeah.
But I think, it's a balancing act. I have to, with having pneumonia and COVID and this car accident, I was driving home today. I'm like, I have to take care of my mental health. I have to
Yes, yes,
make an
yes.
appointment to see somebody. Um,
Mm-hmm.
with little things that like, it's one more thing to do, but I know I have to do it.
Right.
So yeah, and live and learn, and but boundaries are something I've become better at as I've gotten older. And
Yeah.
you just gotta sometimes be like, yeah, no, I don't like drama and I hate when I'm invited to it. So that's why I don't have to join. I could say no to your drama and it's
That's
okay.
yeah. I need to repeat that to myself. Well, thank you so much. I want to give you some time to rest because you've been
Yeah,
through a lot. Your voice is, I know, getting a little tired, but thank you so much. And I will share all of your links to your social media and your so if people want to, see what you've written in your blog, they can do that. So thank you again.
thank you, Cheryl. It's been a pleasure.
I'm so glad to be able to talk longer and we should do this again sometime. Bye bye for now.
All right, bye bye.